If you are over 60, take a moment to read this carefully. What follows could make a real difference between staying independent and losing the ability to live on your own terms. Walking is beneficial, there is no question about that. But here is what current research consistently shows. Walking alone is not sufficient to prevent the muscle loss and weakness that leads to falls, fractures, and dependency as we grow older. A comprehensive review covering 116 studies and more than 25,000 older adults found that exercise programs specifically designed to target balance and strength reduced falls by 23%. The key finding, however, was this: the most effective exercises were not simply walking. They were targeted lower body strength movements that challenged balance and developed muscle power. In this video, you will learn 5 chair exercises that require less than 15 minutes and can be performed safely in your living room. These are not random movements. Every exercise is supported by published medical research. Toward the end, we will also cover why most people fail to stick with exercise programs and exactly how you can avoid that outcome. Why your legs determine your independence before getting into the exercises. It is important to understand what is happening in your body right now. According to research published in the Journal of Rehabilitation Medicine, ankle dorsiflexion delay, your ability to lift your toes upward toward your shin, can predict who is likely to fall within the coming year. In a study of 54 healthy adults over 60, participants were observed for 1 year. Of the 16 people who fell, every single one showed a common pattern: delayed ankle movement and reduced range of motion while walking. What this means for you is straightforward. The strength and mobility in your ankles, knees, and hips directly determine whether you can recover your balance when you stumble. There is also this important fact. Research shows that just 10 days of bed rest causes older adults to lose 13% of their leg strength, nearly twice as fast as younger people. During illness or surgical recovery, muscle mass can decline by up to 3% per day in the first week alone. Walking helps maintain what you currently have. But these chair exercises build the specific strength and power needed to prevent falls and preserve your independence. What you will need, the equipment required, is minimal. All you need is a sturdy chair without armrests. A kitchen or dining room chair works perfectly. Make sure the chair does not have wheels and will not slide on the floor during movement. No additional equipment is necessary. No weights, no resistance bands. Just your body and a chair. Exercise 5. The seated ankle pump. We begin gently with the foundation of all movement, your ankles. A 2021 study found that 86% of community-dwelling older adults had limited ankle mobility. Research also confirms that ankle plantar flexor strength, the strength of your calf muscles, is significantly linked to balance and fall prevention. How to perform it? Sit near the front of your chair with feet flat on the floor, hip width apart. Maintain an upright posture. Slowly point your toes downward toward the floor as far as comfortable. Feel the contraction in your calf muscle and hold for 2 seconds. Then pull your toes upward toward your shins as far as possible, feeling the stretch along your ankle and lower leg. Hold again for 2 seconds. Continue alternating point and flex for 60 seconds. Breathe naturally throughout. If you experience cramping, slow the movement and reduce your range of motion. This movement activates what researchers refer to as your second heart. Each time your calf contracts, it pumps blood and fluid back toward the heart. Studies on ankle mobility confirm that weight-bearing dorsiflexion range of motion is a reliable predictor of dynamic balance performance. Greater ankle mobility means a better ability to react when balance is disrupted. Exercises 4-3. Marching and leg extension. Exercise 4. Seated marching, 30 seconds. This movement activates your hip flexors, the muscles responsible for lifting your legs. Remain seated with feet flat on the floor. Rest your hands on your thighs or hold the sides of the chair for support. Lift your right knee upward toward your chest as high as comfortable. You are not aiming to touch your chest, simply to lift with control. Lower it back down in a controlled manner, then lift the left knee. Continue alternating for 30 seconds. The critical element here is core engagement. Draw your navel gently toward your spine and sit upright throughout. Do not lean back into the chair. Research on lower limb strengthening confirms that exercises engaging the hip flexors improve mobility and reduce fall risk. These are the same muscles used every time you climb stairs or step over an obstacle. Exercise 3. Seated leg extension, 10 repetitions per leg. This targets the quadriceps, the large muscles along the front of your thighs. These muscles are essential for standing up, sitting down, and walking safely. A study on the sit-to-stand test found it was strongly correlated with leg press strength and knee extensor power. Stronger quadriceps make everyday activities noticeably easier. Sit fully back in the chair so your back is supported. Place your hands on the sides for stability. Keep your left foot flat on the floor. Slowly extend your right leg straight out until it is parallel to the floor or as close as you can manage. Point your toes toward the ceiling and squeeze your thigh muscle. Hold for 2 seconds. Then slowly lower your foot back down with control. Do not let it drop. Complete 10 repetitions on the right leg, then switch to the left. If full extension is not possible, go only as far as comfortable. The muscle is still engaged and benefiting. For an added challenge, pause at the top and perform small upward pulses before lowering. Exercise 2. Seated hip abduction, 10 repetitions per leg. This exercise builds strength in the outer hip muscles, which provide stability during walking and single leg standing. Sit upright near the front of the chair with feet flat on the floor, hip width apart. Rest your hands on your thighs or hold the sides of the chair. Keeping your right leg straight, slowly lift it out to the side as far as comfortable. Keep your foot pointing forward. Avoid letting it rotate. Hold for 2 seconds at the top. Then bring the leg back to center with control. Complete 10 repetitions on the right, then repeat on the left. You may not be able to lift very high, particularly at the beginning. That is entirely normal. Even small movements are actively strengthening these critical stabilizing muscles. Research on fall prevention has directly linked hip abductor weakness to increased fall risk in older adults. These muscles maintain lateral stability and body alignment, especially during the moment when all your body weight shifts to a single leg while walking. Exercise 1. The sit-to-stand 10 repetitions. This is the single most important functional movement for maintaining independence. The reason is simple. This exact pattern is something you perform dozens of times every day. Rising from a chair, getting up from the toilet, standing from your bed. Your ability to do this safely is a primary factor in whether you can live independently. A study of 1,840 older adults found that sit-to-stand muscle power was strongly associated with cognitive function, physical performance, and overall quality of life. Research further confirms it is among the most clinically relevant tests of functional ability available. How to perform it correctly. Sit near the front of the chair with feet flat on the floor, hip width apart. Extend both arms straight out in front of you at shoulder height. This serves as a counterbalance. Lean your chest forward over your toes, shifting your weight forward. Squeeze your glutes and push through your heels to rise to standing. Do not use your hands to push off the chair. Once standing, slowly lower yourself back until your seat barely touches the chair. A light tap. Then immediately rise again. Complete 10 repetitions, moving slowly and with control. Each repetition should take approximately 4 to 5 seconds. If this feels difficult, use one of these modifications. Place a firm pillow on the seat to raise the height, making the movement easier. Position a sturdy surface in front of you and hold it lightly for balance support. The goal over time is to perform this without using your hands at all. Dr. Thomas confirms this exercise builds leg strength, improves body mechanics, and directly lowers fall risk. Studies recommend 10 repetitions twice daily for maximum benefit. Consistency, action plan, and closing the one mistake that undermines progress before assuming 1 or 2 sessions will produce results. Consider this important finding. A meta-analysis of fall prevention exercise programs determined that exercises must be performed at least twice per week, with 3 times per week being optimal, over a program lasting 8 to 12 weeks. Consistency is not optional. Your muscles require regular stimulus to maintain and build strength. The recommended approach based on Dr. Thomas's guidance. Complete this 5-exercise routine 3 times per week. Monday, Wednesday, and Friday is a practical schedule. The full routine takes fewer than 15 minutes. Place it in your calendar, set a phone reminder, and treat it as seriously as any prescribed medication. What the research suggests, you can expect a randomized controlled trial involving 124 individuals aged 80 and above found that those who performed strength and balance exercises at least 3 times per week experienced a 43% lower fall risk compared to those who did not exercise. Additional studies reviewed by Dr. Thomas showed improvements in the 30-second chair stand test, translating to better ability to rise from chairs, improved walking speed, and enhanced balance. These benefits, however, are contingent on consistent effort. Today, work through all 5 exercises one time. Focus on learning the movements rather than performing them perfectly. Rest the following day, then complete the routine again the day after. From that point, commit to 3 sessions per week for 8 consecutive weeks. Keep a brief written record. Note the date each time you complete the routine. Research shows that people who track their activity are significantly more likely to sustain it long term. One essential reminder: if any exercise produces sharp joint pain, stop immediately. Muscle fatigue and a mild burn are expected and indicate the muscles are working. Joint pain is not acceptable. Reduce your range of motion or skip that exercise if needed. Weakness and frailty are not unavoidable consequences of aging. While muscle mass naturally declines over time, the rate of that decline is largely within your control. Research conducted on adults in their 80s and 90s demonstrated that even the oldest individuals showed meaningful muscle growth and strength gains through resistance exercise. Your muscles do not have an expiration date. A 2020 review drawing on data from over 25,000 older adults confirmed that well-designed exercise programs reduce fall rates by approximately 23%. The exercises that produced the best outcomes were precisely like the ones covered here: targeted strength and balance movements that engage both the muscles and the nervous system. You have the ability to change your trajectory. These chair exercises offer a safe and accessible path to building the strength required to remain independent. As Dr. Thomas emphasizes, the research is clear. These movements improve strength, enhance balance, reduce falls, and preserve independence. You deserve to move through life with confidence and capability, and you do not need a gym or expensive equipment to get there. Just a chair, 15 minutes, and a commitment to showing up consistently. Try these 5 exercises this week and observe how your body responds. The results may genuinely surprise you. If this information was valuable, please click the like button. It helps reach others who need this content. Subscribe for more evidence-based guidance on healthy aging. Your body remains capable of remarkable things, even after 60. Now you have the tools. Put them to use.